My name is Dr. Hamid Shaaban. I'm the Chief Medical Officer here at St. Michael's Medical Center. I'm also trained in infectious disease and hematology oncology. I work closely with the departments and also integral in the faculty department for internal medicine residency program. So one of the things that we've been doing at St. Michael's Medical Center is, which has been integral in tackling this problem, is having the daily coronavirus task force meetings, which includes the CEO, the CMOs, the nurse managers, the residents, and on a daily basis we emphasize public health, education. We talk about the fact that we discuss about the shortages with regards to personal protective equipment and how we can address those issues, and daily infection control measures to educate our staff, especially with the proper isolation strategies. So we're lucky here at St. Michael's with regards to the fact we have a fellowship program. We have faculty that are critical care trained. We have fellows that are training in critical care medicine. And more importantly, we have residents who are rotating through the critical care faculty. So through the rotation. So based on that, we are prepared. It is a serious condition. And we should respect the virus, not fear it. What I've been emphasizing on a daily basis is that we should lead with facts and not fear. So issues such as personal protective equipment, I go back to that because that's a serious issue. That is what causes some of the fear, that when we're ready for this. It's just some of the fear is driven by the fact that we are concerned we don't have the equipment to tackle this problem. My message out to all the young kids out there in Newark, New Jersey, this is a serious issue. We need to take it seriously. And when the state tells us that we need to stay at home, we need to stay at home. The way you minimize spread of transmission is by containment. So social distancing, that has been shown in prior viral pandemics to work. If you're sick, stay at home. Don't go out, avoid mass gatherings, avoid crowds. That's what really perturbed me when it came to the issues that took place in this weekend in Newark, because that is exactly what you shouldn't be doing. And it takes each and every single one of us. It's not just the doctors, it's just not the healthcares. Here's a condition where it's actually, instead of being a patient-centered approach, it is a population approach, it's a community approach. So we really need the community just as much to contribute to helping us in controlling this pandemic. In our community, there is an issue that most of our patients do not have primary care physicians. And I think especially in the underserved population, these centers should have been popped up immediately. And they're slowly popping up, which is great. But the onus should be on focusing on the underserved population, which patients who do not have primary care physicians. The homeless, the undocumented, we deal with that here in St. Michael's Medical Center. The undocumented are scared to come to the emergency room because of fear. Their number one fear is deportation. Going back to my point that this is a common problem. All of us have to look out for each other. They should not fear seeking medical attention right now, because if that one person is going out there in the community spreading this virus, that affects us all. So we need to focus primarily, I think, in this public health emergency at the underserved population. Essex County is working on getting these testing centers set up. I think we need to do it sooner rather than later. The urgency is here, and because the more you can the more people you test, the more positives you can identify, and you can isolate from the community, and that's how you contain. I tell this to my colleagues over and over again. The way you deal with this pandemic is 3 C's, and it's containment, containment, containment. I'm afraid of fear is part of human nature, but at the same time, the responsibility is on me that if I indeed do get it, I need to quarantine myself, because just as I educate my patients, I need to do it. I need to do the same. This is what we were trained for. When I went into medicine, it was for moments like this, that you rise to the challenge and step up and basically help your fellow man. If this is not, this is exactly the moment we were trained for.